Okay, so now we'll be going over interdental aid techniques. So the first one is the interdental brush. So you need to grab a brush that's the right size to fit your interdental space. So this is the only one we had, unfortunately, but you will still get the idea. You just wet the brush with water and insert it on an angle, keeping the gingival in a normal shape. So you're not like shoving it in there. You just kind of push it in and then pull it out, and make sure you're doing this on both sides here. And if you do have bigger gaps and you don't have the right brush size, I would also, you can go from this side and pull it out. But yeah, you have to make sure once you're done with these, if they are the disposable ones, to make sure to dry them and throw them out before it gets too deformed.
Go.
Okay, the next interdental aid is the end tuft brush. So this is more so for like if you have like deeper grooves, or if you have to go into like the subgingival area here, or even mostly for like back molars that are kind of hard to reach. But you place the brush tip on the surface that you're gonna clean, and then you use a small circular kind of like sweeping motion and focus on the gum line and like more so like hard to reach areas. So if you have a lot of like pits and fissures as well, this is great for those types of teeth. But yeah, just keep in mind those two areas, and that's it. So the next interdental aid, this one is for if you have braces. It's basically like pick floss, but for people with braces, so that it's a little bit easier to get the floss in there. But this is the platypus one. So basically this thinner part is to get underneath the wire, and when you stick it in, make sure you are going into the subgingival margin and doing a C motion up, and then repeat on the other tooth. And you would just do that for every single tooth. And this one's really good even if you need to get into your back molars as well, because it's easier to use than like actual string floss. But yeah, that's pretty much it. And then both picks have this little small tip area. This one does have little ridges on it, but this is for smaller interproximal areas. So if you have this small like little gap in between your teeth there where the gum is receding, this is really good for that. And it's also really good to get under your wires if there's something stuck under there. And yeah, that's pretty much it. So this one here is a floss pick. This is the adult size. There's not really like a specific child size, but this one is if you wanted to get your child to do it more. It's a bit smaller and it's a little more fun looking. But this one is very similar to the platypus. It's just for if you don't have braces and you just don't want to use string floss. But yeah, you basically just go in between and make sure you're doing a C so that it's going underneath the actual gum line here, and C motion on each side. You don't want to go like this just because that will disturb the tissue in between. But yeah, this is probably the easiest method. If you don't have open contacts, it's probably the easiest to actually get floss in. That's it.
The next technique I'll be demonstrating is floss, string floss. So you want to do it right after you finish brushing your teeth. There's two kinds of floss. There's a wax and unwax. And the way you want to do it is you want to cut a string long enough. You can measure it from the tip of your fingers to the end of your elbow. And you want to wrap it around your middle finger, like so. And then you can use your index finger or your thumb to go in between the gingival margin of the teeth. So you want to make sure it's tight enough so you can wrap the floss. And what you want to do, it's called a C-shape motion, which it's like you're hugging your teeth so you can get right into the sockets and clean anything that's stuck in between there, like so. Just push it like this. It's like a C. Just go back and forth. What you don't want to do is drag the floss right down, because you'll get an injury and you'll cause damage into your gums, and it's not really recommended, and also it's irreversible if you hurt your gums, so you don't want to try that. Okay, so the next technique is it's pretty much just like flossing, but it's with the floss holder. I'm going to show you how to assemble it. It's pretty much the same thing as regular flossing. So you want to get a string long enough so you can wrap it around it like so. I'm gonna give it like 2 or 3 wraps around this part right here, and then you want to make sure that you get in between these areas so it's nicely tight like that. And then you want to wrap it you want to wrap it again at the bottom so it's nicely tight like that. And then you want to go into the sockets of the gum like this, and you also do this the C-shape motion as well. It's also a great tool for people that have poor dexterity. You also are able to get further back into the mouth, especially around the molars, the back molars. Use it this way and just like so, back and forth using the C-shape motion. This right here is a rubber stimulator. It's used to actually get it to in between the interproximal areas, and what you want to do is gently massage in between the teeth and trace in between the marginal gum area, and like gently, you want to do it gently in between like so.
So the next one here is called a soft pick. It's got this little, the end here has all these little ridges. It's just made of rubber, so it's super soft. And this is really good for the interproximal areas between the teeth. If you have any, after you eat any big chunks of food, you just go in between there and just poke. And it's really good for getting in between. You can also use this in conjunction with string floss if you want to just get a little extra in those interproximal areas. Just like that.
Oh.
Yeah. So the next one here, this is called a floss threader. This is used with a piece of normal string floss. This is to help, so for people that have braces, or if they have a fixed lingual retainer and they can't get just the floss and push down, they need the floss threader to go in between the teeth. So how you're going to use this, you're going to cut a piece of normal floss the length of your forearm. Then you're going to take one end and you're going to take your floss threader and you're going to just thread it through the loop and pull it until you have about an equal length on both sides. And then you're going to take the single end of your floss threader and you want to thread it through the interproximal area of the teeth. Okay, so this would go right under the wire for braces or for a fixed lingual retainer. And then you're going to take both ends once it's in the tooth, and you can just use it like you would normal floss. Wrap it around, wrap it around your middle fingers. Okay, and then you're going to do that C-shape method where you're kind of hugging the tooth and go into those, the gingival margin there. And then when you're done, after you do it a few times, you can just pull it through and go in between another